Hello, I am Dr. Girish Nelivigi, Urologist and Andrologist from Nelivigi Multispeciality and Urology Hospital, Bangalore. Today, we will be talking on a very common urological topic, that is circumcision. Circumcision is a surgical procedure where the foreskin of the penis is removed. Now, it is done for religious reasons and medical reasons. It is commonly done in Muslims and Jews for religious reasons, but for medical reasons it is done for various indications. The most common reason why circumcision is done is because of the narrowing of the foreskin in children. Normally at birth the foreskin is narrow, but as the child grows up the foreskin becomes loose and it opens up to enable the free passage of urine. However, in some children, the foreskin remains very narrow, in which case the child complains of pain while passing urine, itching of the skin of the penis, and also he cries when he passes urine, and sometimes there could be infection of the urine. A second reason why circumcision is done is because of the infection of the foreskin called ballonoposchitis. This is an infection of the foreskin which commonly occurs in people with diabetes. This occurs when the blood sugar level goes up very high and the skin of the penis becomes infected. There are cracks on the foreskin. Sometimes there could be bleeding of the foreskin. The retraction or withdrawal of the foreskin becomes very painful and it may affect the day-to-day life as well as sexual intercourse. The treatment for infection of the foreskin is by antibiotics, but if there is a repeated infection, then circumcision is the answer as a permanent cure for this. Now, let us talk briefly about circumcision. Circumcision is a minor surgical procedure done under local anesthesia in the adults. In children, it is done under general anesthesia because children do not cooperate inside the operation theatre. Here, the foreskin of the penis is removed and stitching is done. Commonly, it is done by two techniques. One is by the traditional technique where we use a scissor or a knife to remove the foreskin and stitch the raw area. The stitches are absorbable, which means they don't have to be removed. Usually after 8 to 10 days they fall off. The second type of circumcision is a technique called stapler circumcision or ZSR circumcision. Here a stapler or a circumcision stapler is used to cut as well as stitch the skin raw edges using a row of staples. These staples fall off after about 10 days. So circumcision is a daycare procedure, which means the patient is not admitted and he can return back to most of the activities like climbing, walking, even driving on the same day. However, for the complete wound healing, it takes about 3 weeks, which means a sexual intercourse can be resumed only after 3 weeks because of the pain. So if you have any of these problems, please visit a urologist so that he can evaluate and treat you accordingly. Thank you.